Good morning, everyone. Today, we will delve into a comprehensive analysis of a complex congenital heart defect known as tetralogy of Fallot. This condition is characterized by a combination of abnormalities in the structure and function of the heart, resulting in significant challenges for affected individuals. By the end of this session, you will have a thorough understanding of the intricacies of this condition, its pathophysiology, clinical manifestations, treatment options, and long-term implications for patients. So, without further ado, let's begin our exploration of tetralogy of Fallot. In summary, tetralogy of Fallot is a congenital heart defect caused by developmental abnormalities in the cardiovascular system. It involves a ventricular septal defect and an overriding aorta, among other structural malformations. To summarize, tetralogy of Fallot involves a ventricular septal defect that allows mixing of oxygenated and deoxygenated blood, leading to decreased oxygen saturation. Additionally, obstruction in the right ventricular outflow tract reduces pulmonary blood flow and increases right ventricular pressure, resulting in cyanosis. Cyanosis, a bluish discoloration of the skin and mucous membranes, occurs in tetralogy of Fallot due to abnormal mixing of oxygenated and deoxygenated blood in the heart. This can lead to complications such as clubbing, polycythemia, and hypoxic spells. The presence of a ventricular septal defect is crucial in tetralogy of Fallot. It allows for the mixing of oxygenated and deoxygenated blood, depending on its size. This defect also contributes to hemodynamic changes and right ventricular hypertrophy. In tetralogy of Fallot, the right ventricular outflow tract is obstructed, impeding the flow of blood from the right ventricle to the pulmonary artery. This obstruction can result from various anatomical anomalies, including narrowing of the pulmonary valve, hypertrophy of the right ventricular muscle, and abnormal positioning of the muscles surrounding the outflow tract. The presence of this obstruction leads to decreased pulmonary blood flow and increased right ventricular pressure. Consequently, unoxygenated blood is partially diverted from the right ventricle to the left ventricle through the ventricular septal defect, intensifying cyanosis. An overriding aorta, a characteristic feature of tetralogy of Fallot, refers to the abnormally positioned aorta that arises above the ventricular septal defect rather than exclusively from the left ventricle. This misalignment results from the malformation of the conotruncal region during cardiac embryogenesis. The overriding aorta has clinical significance as it contributes to the abnormal mixing of oxygenated and deoxygenated blood within the heart, exacerbating cyanosis. Additionally, it can impact the relationship between the aorta and the pulmonary artery, potentially leading to further complications and challenges in surgical management. In tetralogy of Fallot, the obstruction of the right ventricular outflow tract leads to increased resistance against which the right ventricle must pump blood. The chronic workload imposed on the right ventricle eventually results in right ventricular hypertrophy. Right ventricular hypertrophy is a compensatory mechanism, allowing the right ventricle to generate the necessary pressure to overcome the obstruction. However, this adaptation has long-term consequences, potentially leading to impaired right ventricular function, arrhythmias, and even heart failure if left untreated. TET spells, or hypercyanotic episodes, are acute episodes of severe cyanosis and respiratory distress that can occur in individuals with tetralogy of Fallot. These spells typically manifest during times of increased sympathetic activity or decreased systemic vascular resistance, such as during crying, feeding, or physical exertion. Recognizing and managing TET spells promptly is crucial to prevent further complications and potential cardiac decompensation. Strategies for managing TET spells include calming the affected individual, administering supplemental oxygen, and implementing knee-to-chest positioning to increase systemic vascular resistance. Surgical intervention is the mainstay of treatment for tetralogy of Fallot. The specific surgical approach depends on numerous factors, including the patient's age, severity of symptoms, and anatomical considerations. Complete repair aims to correct all the abnormalities associated with tetralogy of Fallot, including closure of the ventricular septal defect, widening of the right ventricular outflow tract, and repair of the pulmonary valve. Palliative procedures, such as a systemic pulmonary shunt, may be necessary in some cases to improve oxygen saturation and alleviate symptoms before definitive repair can be performed. Despite successful surgical repair, individuals with tetralogy of Fallot are at risk of developing long-term complications. These complications may arise due to residual defects, abnormal development of heart structures, or the impact of abnormal blood flow patterns. Common long-term complications include arrhythmias, such as supraventricular and ventricular arrhythmias, pulmonary valve regurgitation, and residual ventricular septal defects. Regular follow-up and cardiac monitoring are essential to detect and manage these complications promptly. The prognosis for individuals with tetralogy of Fallot has significantly improved over the years, thanks to advancements in surgical techniques and perioperative care. Early detection, accurate diagnosis, and timely intervention are crucial factors that influence long-term outcomes. Successful surgical repair often leads to excellent outcomes, with most individuals experiencing improved exercise tolerance and a good quality of life. Factors influencing prognosis include the timing of surgical intervention, the presence of associated anomalies, the severity of the underlying heart defects, and the long-term management of complications. Advancements in tetralogy of Fallot management include percutaneous pulmonary valve implantation as a minimally invasive alternative to surgery. Future therapies like tissue engineering and regenerative medicine are being explored to repair damaged heart tissues for improved long-term outcomes. To summarize, tetralogy of Fallot is a complex heart defect that requires a comprehensive understanding of its origins, symptoms, treatment, and long-term implications. Equipped with this knowledge, future doctors can provide better care for affected patients.